do that retraction backwards, a lot of our patients will want to overextend the neck forward, almost like you're a turtle kind of coming out of its shell. So we don't want to do that. We just want that nice retraction and then return to normal. Hey everybody, this is Mike, Kalkstein Chiropractic. I'm here with Tanisha today, and today we're going to be looking at some McKenzies or some functional movement patterns. We're going to be focusing the video today solely on the neck and the low back. But again, we can do McKenzies for basically every joint that we have. We have knee McKenzies, we have hip McKenzies. So any of those joints that you're having problems with, just know, even though this video is focused on the neck and specifically the low back, we can also help you out with that. We're just kind of going over what's a little bit more common, a little bit more popular here in the office. So today, like I said, Tanisha is going to be helping me out here. We're going to start with our cervical McKenzies. So with our cervical McKenzies, it's best to do it seated. So we're seated nice and tall. We're not slouched over. We're not hyperextended, you know, over exaggerating a proud chest. We're just at a natural, nice seated posture. So what we're going to be doing here is we are going to pretend that our head is on a train track, if you will. We don't want to go down. We don't want to go up. We want to go nice, straight, forward and back. So Tanisha, go ahead and pretend like you've never done this movement before, just so the audience can kind of learn it with us, if you will. So now what we're going to be doing is we're going to start with our retraction. So we're going to be pretending like, you know, you're at a family gathering, you've got an aunt or an uncle that you don't really care for, and they're coming up to give you a kiss. What's the first thing that you're going to do? Naturally, you're going to go, oh, exactly. So that's going to be the whole movement. We're not going to do it that fast. It's not going to be that jerking motion. But we're gonna go nice and controlled. We're gonna go all the way back as far as we can. And then this is the part we have to emphasize here. When we return back to the movement, we wanna go to a neutral neck position. So go ahead and do that for us, Tanisha. Perfect. So a lot of times when we end up doing this, and this is why if you're practicing this at home, try your best to either film yourself or have a friend watching you or a family member, because a lot of times, and Tanisha can do it with me, when we do that retraction backwards, a lot of our patients will want to overextend the neck forward, almost like you're a turtle kind of coming out of its shell. So we don't want to do that. We just want that nice retraction and then return to normal. So Tanisha, go ahead and get a couple reps going for us, and we're going to kind of talk through this movement. So again, it's not going to be as nice as Tanisha's movement if you're in a lot of pain. Totally normal. All we're really looking for is a little bit of pressure right in the back of the neck at that full extension. You should feel it maybe in the top, maybe a little bit lower, but you should feel it somewhere in this general area, that little bit of pressure. Now, with any of our McKenzie movements, we like to operate at a red light, green light basis. So let's pretend here that if Tanisha was in a lot of cervical pain, a lot of neck pain, the way that we would do a red light is if at any point in time, if we had radiating pain down either arms that got worse, let's say it was only going to the forearm, and during one of those repetitions that pain went down to the fingers, that would be what we would call a red light, meaning we're probably not either doing the motion correctly, or we might be doing a movement pattern that is actually counterintuitive to kind of healing or benefiting the area that we're going for. So again, if radiation increases, if pain at the area or at the site of your real cause of trouble, so bottom of the neck, top of the neck, wherever it may be, if that increases at all, that's going to be one of those red light situations. Now a green light, to say, hey, even though it might not be the most comfortable, but it's working, what that would look like is, let's say we do have that radiation of pain, like I said earlier, in the forearm. Let's say it's no longer in the forearm, but it's in the bicep, or even up there in the shoulder, but it hurts worse. Even though it's counterintuitive, that's actually going to be a green light, because we're localizing the pain back to the source of pain. Now, even if it's more intense in the neck, but we're losing that radiation, again, that's a green light. We're gonna wanna keep doing this. Now, with these movements, we actually want to be a little bit heavier on the repetition side. And again, I know the first couple aren't going to feel super comfortable, but as long as we can get ideally about 30 to 40 in per day, that's gonna be really towards the goal that we wanna see. There's not an ideal repetition count, but what we're really aiming for here is just a decrease in our symptoms. If your pain is decreasing at all, if your range of motion, maybe you can't turn as well, if that's suddenly getting better, that's a decrease in symptom, and that's going to kind of be that signal of, hey, maybe you've done enough at this point or for the day. Now let's go ahead and pause the video. We've already talked about the cervical McKenzies, the neck McKenzies. We're gonna go over to one of our bars now and we'll talk about the low back.